The MamasteFit Birth Prep Circuit releases the uterine ligaments, it creates more space in the pelvis, and also releases the pelvic floor, all to help you prepare to open your pelvis for birth so baby can more easily navigate through the space. The first movement is the forward leaning inversion. Forward leaning inversions is when the chest is lower than the hips. With this variation, it's going to be from an elevated position, so this will be the most intense variation. The forward leaning inversion is still a restorative position while it does require some shoulder strength. And what it's doing is it's releasing tension in the lower uterine ligaments and the round ligaments. So the vertical running ligaments are all being released with forward leaning inversions. Sometimes these ligaments can get twisted or torqued where they can decrease space in the lower part of the uterus or even shift the uterine position. And so releasing tension in these uterine ligaments helps the uterus find its best shape to create more space for baby to find their optimal position in the bottom part of the uterus. So it can help your baby be in a head down position. It can also support how they're positioning their head because their head positioning plays a large role in how they will navigate through the pelvis. So if babies are in a really good position and there's plenty of space for them in the bottom of the pelvis, they tend to find a more chin tucked position where their chin is towards their chest, and they're going to present much smaller to the cervix and to the pelvic openings. The next three movements are focusing on releasing the musculature that is bringing us into our common prenatal postural tendency, which is going to be this more extended and arched position. When we are in a more arched or extended position, the pelvis is shifting into more of an anterior pelvic tilt. This pelvic positioning makes it easier for us to find external rotation or knees out, ankles in, which can create more space side to side in the top of the pelvis, but it makes it harder for us to find internal rotation, which opens the lower half of the pelvis, and it makes it harder for us to find a posterior pelvic tilt, which is important because it moves the sacral promontory or the junction between the sacrum and the lumbar spine backwards, which is going to create more space from front to back. So a posterior pelvic tilt is really important to create space in the front to the back of the pelvic inlet to help baby enter into the pelvis. It can influence how baby is going to rotate through the pelvis and then ultimately going to help us create more space in the bottom half of the pelvis by helping us find internal rotation. And so because the common postural tendency during pregnancy is extension, where we're arching in the back and the pelvis is tipping forward, it can be really hard for us to find those two important movements of a posterior pelvic tilt and internal rotation. So the first movement that we're going to do to help with this is going to be our back expansion breathing drill. This is going to help us find a more rounded position and feel this in our body. And so you're going to breathe for 5 to 10 breaths in this rounded back position, holding onto a sturdy structure. The next two movements are going to be releasing the musculature that is pulling the pelvis into that anterior pelvic tilt. So it's releasing the lat muscles and then releasing the hip flexor muscles that are pulling the pelvis down and pulling the pelvis up. And so with these three movements helping to release us from this extended position, it will then make it easier for us to move into the final two movements, which are going to be focused on our internal rotation and posterior pelvic floor release, which for a lot of us is very tight. So the next movement will be the all fours pelvic tilt from a hip shifted position. So we'll use a yoga block to find a hip shift within the tabletop position, and then we're going to do pelvic tilts from there. This movement is going to help us find spinal mobility and pelvic mobility and help us feel more of that posterior pelvic tilt and move into more of that extended or anterior pelvic tilt, because movement is important. We don't want to only find a tucked position. We want to be able to freely move from front to back. With the hip shifted positions, we're also going to be emphasizing internal rotation. So we're going to shift weight into one leg, which is going to create more space here in the back half of the pelvis, which then is going to stretch that pelvic floor musculature that attaches. So for a lot of us, the back half is a lot tighter, and we tend to be in more of a position like this. So these hip shifted positions are going to create more space there to allow baby to move deeper into the pelvis and rotate more easily. The final movement will be our supported standing hip shift. So this will be the most active position of the 6. From this, you're gonna hold on to a sturdy structure and we're gonna find that same hip shifted position. This is also gonna be a little bit of a lat release and a really big pelvic floor release movement. And so the combination of these movements are gonna help to release tension within the uterus to help with baby's position. So the vertical running ligaments can change the tension and the shape of the uterus. And so we wanna release and find balance so baby can find their best position. The next things that we're going to be focusing on is helping us find more of that posterior pelvic tilt, find more of that internal rotation by releasing tension in the musculature that's pulling us into that common prenatal postural tendency of extension and an anterior pelvic tilt. So releasing in the lats, that's going to let us come more backwards, and then also releasing in the hip flexors. The back expansion breathing drill is how we'll start and prime our bodies to be ready to find that more rounded position. We'll finish the circuit with our hip shifted positions, which will be emphasizing internal rotation, and so creating more space here in the lower mid pelvis and the back half of the pelvis, and releasing tension within the posterior pelvic floor. So the MamasteFit Birth Prep Circuit is helping us find two really important movements for birth that tend to be harder for us to achieve, which is that posterior pelvic tilt and internal rotation, while also supporting uterine ligament release and releasing the posterior pelvic floor. We recommend doing these movements 2 to 3 times a week after 20 weeks and maybe increasing it to 3 to 4 times per week into the 3rd trimester. So the MamasteFit Birth Prep Circuit can help you have a more comfortable pregnancy, because for a lot of us, if we are stuck in the opposite postural tendencies, it can cause more issues such as pelvic heaviness, pelvic girdle pain, maybe even tailbone pain. So finding more of that posterior pelvic tilt, finding more internal rotation and posterior pelvic floor release, you may find helps to relieve a lot of issues that you may be experiencing. In addition to keeping you comfortable throughout your pregnancy, these movements are also preparing you for birth by ensuring that you can find movement patterns that are commonly harder to find during pregnancy and during labor, so that we can create more space in our pelvis so we can support baby finding their best position so they can rotate and descend for an easier birth.